Hello everyone. Today we are going to discuss about the deficiency disorders and their nursing management. So coming first on to the introduction that what actually are vitamins and minerals. So vitamins are the organic compounds required in very tiny amount that cannot be synthesized by an individual and must be obtained from the diet. Whereas minerals are required in trace or small amounts to support biochemical processes involved in the cell structure and function. So some of the examples of important minerals are like calcium, iron, iodine and magnesium. First of all, we'll discuss about vitamin A. So vitamin A is also known as retinol, and the main functions are that it is a necessary pigment for the production of pigment rhodopsin, and it is required for normal bone and growth development, bone growth and tooth development, needed for growth and spermatogenesis, and is involved in thyroxine formation as well. So these are some of the benefits which we have already seen. So the RDA, the recommended dietary allowance, is 5,000 international units of vitamin A. So this is the recommended daily amount of vitamin A that you must take in your diet. So it is 5,000 international units. And the sources are, there are natural sources as well as provitamin sources. So the natural form is liver, kidney, fish oil, milk and non-skimmed milk products along with egg yolk. And provitamin A, that is keratin, is you can get keratin from carrots, sweet potatoes, apricots, spinach, broccoli and cabbage. Then what the deficiency of vitamin A causes. So the main diseases which are caused by the deficiency of vitamin A are night blindness, hardening of epithelium, xerophthalmia, phrenodermia, drying of respiratory, GIT and genitourinary tract, defective tooth enamel, retarded growth, impaired bone formation and decreased thyroxine formation. So the nursing management which you have to do in case of the vitamin A deficiency is you have to encourage foods that are rich in vitamin A, and as the milk consumption decreases, encourage food rich in vitamin A. If the patient is not able to take milk in proper amount, then encourage other food sources that are rich in vitamin A. And administration of vitamin A, that is 5,000 to 10,000 of international units intramuscularly, is done in severe cases. Alternatively, parenteral water-soluble preparation are administered in children with persistent vomiting or severe malabsorption. Then we have vitamin B1, that is thiamine. So the function is coenzyme in carbohydrate metabolism and is needed for healthy nervous development. Then sources are pork, beef, liver, legumes, nuts, whole nuts and enriched grains. You can see here that vitamin B1, that is thiamine, helps the body convert food into energy and aids the function of the heart and cardiovascular system and the brain and nervous system. The RD of vitamin B1 is 1.5 mg and it is water soluble. The deficiency of B1 causes beriberi. In beriberi, the GI symptoms that are seen are anorexia, constipation and indigestion. Neurologically, you can see apathy, fatigue, emotional instability, polyneuritis, tenderness of calf muscles, muscle weakness, convulsions, coma. And cardiovascularly, you can see palpitations, cardiac failure, peripheral vasodilation and edema. So this is how a typical patient having beriberi looks like. You can see here the classical symptom of beriberi, the Wernicke's syndrome. This is also seen in beriberi. There are two types of beriberi. First one you can see is dry beriberi and the second one is wet beriberi. Then vitamin 2, riboflavin, its function is it acts as a coenzyme in carbohydrate, protein and fat metabolism and maintains healthy skin, especially around the mouth, nose and eyes. The recommended dietary allowance is 1.7 mg and it is also water soluble. The sources are milk and its products, eggs, organ meats, enriched cereals, green leafy vegetables and legumes. The deficiency, you can see here in the picture, the dryness or the flakiness around the lips. This is the deficiency of vitamin B2. So it is riboflavonoids, and around the lips it causes chlosis and prelache. Around the tongue it causes glossitis, that is inflammation of the tongue. And nose, it has irritation and cracks at the nasal angle. In eyes, it causes burning, itching, tearing, photophobia, corneal vascularization, and cataracts. And in skin, it causes seborrheic dermatitis and delayed wound healing and tissue repair. Then we have vitamin B3, that is also known as niacin. Its function is it acts as a coenzyme in protein and fat metabolism and needed for healthy nervous system, skin, and normal digestion. The recommended dietary allowance is 19 mg per day, and it is also a water-soluble vitamin. The sources are meat, poultry, fish, peanuts, beans, peas, whole or enriched grains except for corn and rice. The deficiency of vitamin B3 causes pellagra. What is pellagra? Around the mouth, it causes stomatitis and glossitis. In the cutaneous system, it causes sclerodermatitis on exposed areas. In GI, it causes anorexia, weight loss, diarrhea, and fatigue. Neurologically, it causes apathy, anxiety, confusion, depression, and dementia, and may also cause death. So this is a typical vitamin B3 deficiency syndrome in which the person you can see that the inability to absorb vitamin B3 or amino acid tryptophan may cause pellagra. This is a disease characterized by scaly sores, mucosal changes, and mental symptoms. Then we have vitamin B6. It is also known as pyridoxine. It acts as a coenzyme in protein and fat metabolism, needed for the formation of antibiotics, antibodies, and hemoglobin. It is needed for utilization of copper and iron, and it aids in the conversion of tryptophan to niacin. The sources are meats, especially liver and kidney, cereal grains, yeast, soybeans, and peanuts. The recommended dietary allowance of vitamin B6 is 2 mg per day, and it is also a water-soluble vitamin. The deficiency of vitamin B6 causes scaly dermatitis, weight loss, anemia, retarded growth, irritability, convulsions, and peripheral neuritis. Then we have B9. It is also known as folic acid. It acts as a coenzyme for single carbon transfer and necessary for the formation of RBCs. You can see here the B9. The folate aids in the production of RBCs. It aids in the synthesis of DNA, and it works with vitamin B12 and vitamin C to help the body digest and utilize proteins. The sources of vitamin B9 is green leafy vegetables, asparagus, liver, kidney, nuts, eggs, and whole grain cereals. The deficiency of vitamin B9, since it is folic acid and responsible for the production of RBCs, its deficiency causes macrocytic anemia, bone marrow depression, glossitis, and intestinal malabsorption. The causes of folate deficiency may be poor nutrition, malnutrition, impaired absorption, decreased metabolism, increased folate excretion, along with increased demand. Then we have vitamin B12, that is cobalamin. It acts as a coenzyme in the protein synthesis, indirect effect on formation of RBCs, and needed for the normal functioning of nervous tissue. Vitamin B12 is important for metabolism, the formation of RBCs, and the maintenance of the CNS, which includes the brain and the spinal cord. The sources are meat, liver, kidney, fish, milk, cheese, eggs, nutritional yeast, and sea vegetables. Its deficiency causes pernicious anemia. This is a commonly asked question, that the deficiency of vitamin B12 causes pernicious anemia. There are general signs of severe anemia in this, along with lemon yellow tinge to the skin and spinal cord degeneration. These are some of the symptoms in case of anemia. Then the nursing management of vitamin B complex deficiencies. In this, you have to encourage foods rich in vitamin B and stress proper cooking and storage techniques to prevent potency, to preserve the potency, such as minimal cooking of vegetables in small amount of liquid, storage of milk in opaque containers. Advice against fad diet that severely restricts group of food such as vegetarianism. Explore need for vitamins when dieting or when using goat milk exclusively for feeding the infant or when the breastfeeding mother is a strict vegetarian. Then we come on to the vitamin C. It is also known as ascorbic acid, and its function is essential for the collagen formation, increases absorption of iron for hemoglobin formation, enhances conversion of folic to folinic acid, and affects the cholesterol synthesis and conversion of proline to hydroxyproline. The sources are citrus fruits, strawberries, tomatoes, potatoes, melon, cabbage, broccoli, papaya, and mango. Its deficiency causes scurvy, in which the skin becomes dry, rough, and petechic. And in musculoskeletal system, there is bleeding into the muscles and joints, and swelling of the joints can also be seen. In gums, they become spongy, fragile, swollen, bleed easily, bluish red or black color, teeth loosen and fall out. There are signs of anemia, decreased wound healing, and increased susceptibility to the infection. This is a typical picture of a patient having scurvy, in which you can see there is loss of teeth, sunken eyes, and pale skin. The nursing management in this case is you have to encourage the foods rich in vitamin C and investigate the infant's diet for sources of vitamin, especially when cow milk is principal source of nutrition. Stress proper cooking and storing techniques to preserve potency. Wash vegetables quickly, do not soak them in water. Cook vegetable in covered pot with minimal water and for short time. Do not add baking soda to the cooking water. Use fresh fruits and vegetables as soon as possible, store in refrigerator. And store juice in airtight opaque container. Then we have vitamin D. Its function is in the absorption of calcium and phosphorus and decreased renal excretion of phosphorus. The sources of vitamin D are direct sunlight, cod liver oil, herring, mackerel, salmon, and enriched food sources like milk, milk products, cereals, breads, and many breakfast drinks. The deficiency of vitamin D causes rickets, in which there is the head becomes, you can see the carniotypes, deformed shape, delayed closure of fontanelles, and in chest it is Asiatic rosary is seen, Harrison groove is seen, and pigeon chest is the characteristic feature of rickets. And in spine you can have kyphosis, scoliosis, or lordosis. And in abdomen you can find it as a potbelly abdomen or a constipated abdomen. Extremities, bowing of arms and legs, instability of hip joints, and pelvic deformity. And teeth, you can witness delayed calcification of the teeth due to vitamin D deficiency. This is the picture of a baby having rickets. You can see here the bowed knees. This is the characteristic feature of rickets. The nursing management in case of vitamin D deficiency is you have to encourage foods that are rich in vitamin D, especially fortified cow milk. Emphasize importance of exposure to sun as source of vitamin. In caring, maintain good body alignment of the child and handle very gently and minimally to prevent the infection. Then we have vitamin C, that is tocopherol. Its function is in the production of IBCs and protection of hemolysis, muscle and liver integrity, coenzyme factor in tissue respiration, and minimizes oxidation of polyunsaturated fatty acids and vitamin A and C in the intestinal tract and tissues. The recommended dietary allowance of vitamin E is 10 milligrams. It is a fat-soluble vitamin. The sources are vegetable oils, wheat germ oil, milk, egg yolk, muscle meats, fish, whole grains, nuts, legumes, spinach, and broccoli. The deficiency of vitamin E causes hemolytic anemia from hemolysis caused by shortened life of RBCs, especially in the premature infants, and fetal necrosis of tissue. Causes infertility in rats but not in human. The nursing management is you have to initiate early feeding in premature infants, and they may also need supplementation. Then we have vitamin K. It functions as a catalyst for production of prothrombin and the blood clotting factors 2, 7, 9 and 10 by the liver. The recommended dietary allowance is 70 micrograms, and it is a fat-soluble vitamin. The sources are pork, liver, green leafy vegetables, tomatoes, egg yolk and cheese. Its deficiency causes hemorrhage, and bloodshot eye is a characteristic feature of the hemorrhage, in which you can see reddened blood vessels inside the eye. So the nursing management is you have to administer prophylactically to newborns, and other indications include intestinal disease, lack of bile. Prolonged antibiotic therapy may be used in the management of blood clotting time. Then we have various minerals. These minerals we will be discussing in the next slide, in the next video. Then we have the minerals. These minerals we'll be discussing in the following video. Thank you.